This commenter is asking about what medications we use to inject into scars when we're treating problematic scars. So first of all, it really depends on what the actual issue is. So this comment in particular was referring to hypertrophic scars, but hypertrophic and keloid scars, often we start with the same medications. We can change our treatment as we move forward, but typically we start with one of two medications. So we either inject with a steroid medication or a medication that's actually a chemotherapy medication called 5-FU. So let's start with the steroid medication. So Kenalog is probably the most commonly used steroid to inject into scars, and we inject this into scars to turn inflammation off, and it works pretty well in most patients. Now, Kenalog has two problems that come along with it that can be quite troublesome. So problem number one is it can actually cause widening and sinking in of the scar. It can basically overdo its job. So we have a thickened scar, and it can make that scar wider and flatter and actually sometimes sink in and become an atrophic scar. The other problem we sometimes see with Kenalog is hypopigmentation. So where you inject this medicine, you can have a white spot or a lighter spot than what the skin color typically is. So those are the two problems with Kenalog. So the second medication, 5-FU, is a chemotherapy medication, and it slows down rapidly dividing cells. And this medication is a little safer in my opinion. It doesn't have quite the complications that I see with Kenalog. And the main complication you see with it is if you inject too much of it, you can get some scabbing or ulceration on the surface of the scar. It's not super common, but it certainly can happen. And I think a lot of people, when they transition from using a steroid to using 5-FU, have this problem, because when we inject steroids, we tend to inject a lot in the scar till it blanches or turns white. And so people will use the same technique with this second medication, and it can have more problems with the scabbing when you do that. So you typically use less, in my experience, of the 5-FU, but I think it works great. So both of these medications you often have to do multiple times, and you typically want to have a several week period in between injections. So you often see nothing for a week or two, and then all of a sudden you see effects of the medication. So you don't want to do them too close together because it's easier to overdo it that way. So depending on your surgeon or dermatologist who's injecting you, we usually do it every 3 to 6 weeks until we get the effect in the scar that we want. So those are the two medications we inject to improve the appearance of inflammatory or hypertrophic scars in particular. Let me know if you have any more questions.